Hello, I'm Karen Hammond. As a registered nurse practitioner, I have been working with couples trying to conceive for more than 25 years, and I understand the stress and frustration many couples experience. This video program is going to show you how to properly self-administer Follistim AQ Cartridge brand of phollotropin beta injection using the Follistim Pen, a precision injection device. Follistim AQ vial, brand of phollotropin beta injection, Ganirelix acetate injection, and Pregnil brand of chorionic gonadotropin for injection USP. The directions provided in this video complement but do not replace directions by your doctor or nurse. They should be used only after receiving directions from your healthcare professional and reading carefully all of the instructions for use. This video program is an educational service to patients provided by Merck & Company. Follistim AQ Cartridge, phollotropin beta injection, is approved for women to help healthy ovaries to develop and release mature eggs. Follistim AQ Cartridge is also for women participating in an assisted reproductive technology, ART program, to help the ovaries produce more mature eggs. Important safety information. Do not use Follistim AQ Cartridge if you are allergic to recombinant human FSH products. Have a high level of FSH in your blood, indicating that your ovaries may be permanently damaged and do not work at all. Have uncontrolled thyroid, pituitary, or adrenal gland problems. Are allergic to streptomycin or neomycin, types of antibiotics. Have a tumor of the hypothalamus, pituitary gland, breast, uterus, or ovary. Are pregnant or think you may be pregnant. Have heavy or irregular vaginal bleeding and the cause is not known. Have ovarian cysts or enlarged ovaries not due to polycystic ovary syndrome, PCOS. Follistim AQ Cartridge may cause serious side effects in women, including ovarian enlargement and ovarian hyperstimulation syndrome, OHSS. OHSS is a serious medical problem that can happen when the ovaries are overstimulated. In rare cases, it has caused death. OHSS causes fluid to build up suddenly in your stomach and chest areas and can cause blood clots to form. Call your healthcare provider right away if you have pain in your lower stomach area, nausea, vomiting, weight gain, diarrhea, decreased urine output, or trouble breathing. Follistim AQ Cartridge can cause you to have fluid in your lungs, atelectasis, and trouble breathing, acute respiratory distress syndrome. Follistim AQ Cartridge may increase your chance of having blood clots in your blood vessels. Blood clots can cause blood vessel problems, thrombophlebitis, stroke, loss of your arm or leg, blood clot in your lungs, pulmonary embolus, or heart attack. Follistim AQ Cartridge may increase the chance of twisting of the ovaries in women with certain conditions such as OHSS, pregnancy, and previous abdominal surgery. Twisting of the ovary could cause the blood flow to the ovary to be cut off. Follistim AQ Cartridge can cause multiple births. Having a pregnancy with more than one baby at a time increases the health risk for you and your babies. Discuss your chances of multiple births with your healthcare provider. A woman's age, certain sperm problems, genetic background of both parents, and a pregnancy with multiple babies can increase the chance that your baby might have birth defects. The chance of a pregnancy outside of the womb is increased in women with damaged fallopian tubes. The chance of loss of an early pregnancy may be increased in women who have difficulty with becoming pregnant at all. The most common side effects of Follistim AQ Cartridge include cyst in the ovary and stomach pain. These are not all the possible side effects of Follistim AQ Cartridge. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider immediately if you get worsening or strong abdominal pain. Also, Call your healthcare provider immediately if this happens some days after the last injection has been given. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying important product information. Use your Follistim AQ cartridge exactly as your healthcare provider tells you to. Your healthcare provider will tell you how much Follistim AQ cartridge to use, how to inject it, and how often it should be injected. Do not inject Follistim AQ cartridge at home until your healthcare provider has taught you the right way to put the cartridge and the pen device together and to inject yourself. Do not mix any other medicines into the cartridge. Do not change your dose of Follistim AQ cartridge unless your healthcare provider tells you to. Call your healthcare provider immediately if you use too much Follistim AQ cartridge. If you miss or forget to take a dose, do not double your next dose. Ask your healthcare provider for instructions. Use Follistim AQ cartridge only with the Follistim Pen. Read carefully the patient instructions for use that comes with Follistim AQ cartridge before you start using it and each time you get a refill. There may be new information. This information does not take the place of talking with your healthcare provider about your medical condition or treatment. Do not use Follistim AQ cartridge with the Follistim Pen unless your healthcare professional has taught you the right way to inject it and you understand everything. Please familiarize yourself with the parts of the Follistim Pen, the Follistim AQ cartridge, and BD microfine pen needle unit. The Follistim Pen is a precision device for use only with Follistim AQ cartridge. The Follistim Pen consists of the protective cap with a pocket clip, the Follistim cartridge holder, and the pen body, which consists of the black rod, the dosage window, the dosage knob, the dosage scale, and the injection button. The Follistim AQ cartridge consists of the rubber inlay, the metal rimmed cap, and the rubber piston. The BD microfine pen needle unit consists of the outer needle shield, the protective paper seal, the inner needle shield, and the BD microfine pen needle. This video tells you how to properly self-administer Follistim AQ cartridge using the Follistim Pen at home. The procedure consists of several steps. Just follow all of the instructions carefully. Please make sure that you read the information inside the package. Before showing you how to give the injection, we will run through the steps of how to prepare the Follistim Pen. This is what you will need for the injection: a Follistim Pen, a Follistim AQ cartridge, the BD microfine pen needle provided with the cartridge, a clean surface, alcohol, cotton balls, or alcohol pads or wipes, sterile gauze, antibacterial soap, and a puncture-proof container to discard the used needles, cartridges, and other supplies. Follistim AQ cartridges should always be stored in a safe place out of reach of children. The Follistim Pen is not recommended for the blind or visually impaired user without the assistance of an individual with good vision, trained in the proper use of the injection device. Follistim AQ cartridges and BD microfine pen needles may only be used with Follistim Pen. Remove the cartridge out of the refrigerator. Injecting cold drug is likely to cause discomfort. Therefore, it is recommended that you allow Follistim AQ cartridge to reach room temperature before taking the injection. Check the liquid in the cartridge. It should appear clear and colorless. If the solution is not clear and colorless or has particles in it, do not use it. Follistim AQ cartridges are available in the following strengths: 300, 600, and 900 international units of recombinant FSH per cartridge. The color of the metal cap indicates the contents of the cartridge. A silver cap indicates 300 IUs. A gold cap indicates 600, and a blue cap indicates 900 IUs. In this video, we will demonstrate the 600 IU cartridge. Follistim AQ cartridge, Folitropin beta injection, is delivered by the Follistim Pen, which accurately delivers the dose to which it is set. Your doctor will decide the dose of Follistim AQ cartridge, Folitropin beta injection, to be given. This dose may be increased or decreased as your treatment progresses, depending on your individual type of treatment. If you have previously used other gonadotropins, your dose may be different with Follistim AQ cartridge. Again, your doctor will decide the dose based upon your medical history. It is very important that you accurately follow your healthcare professional's instructions. Check the package labeling and expiration date of the cartridge. Do not use the product if it is past expiration. Always wash your hands thoroughly with antibacterial soap before you start. At the start of your Follistim AQ cartridge treatment, and each time you need to use a new Follistim AQ cartridge, take the Follistim Pen, and while holding the pen body firmly with one hand, pull off the protective cap with your other hand. Put the protective cap aside on a clean, dry surface. Unscrew the pen body from the cartridge holder. Put the cartridge holder and pen body aside on a clean, dry surface. For the next step, you will need the yellow cartridge holder and the correct strength of Follistim AQ cartridge as prescribed by your healthcare professional. Look at the cartridge. Do not use if solution contains particles or if the solution is not clear. Clean the rubber inlay on the cartridge with an alcohol pad. Insert the Follistim AQ cartridge into the yellow cartridge holder. Make sure that the metal-rimmed cap goes in first. Pick up the Follistim pen body and lower it into the cartridge holder. Screw the Follistim pen body onto the cartridge holder with the cartridge in it. The black rod must press against the rubber piston of the cartridge. Screw the cartridge holder toward the body, making sure that the arrow on the cartridge holder points to the middle of the yellow alignment mark on the blue pen body. Tighten firmly, but do not over-tighten. Check that there is no gap between the Follistim pen body and the cartridge holder. If there is a gap, unscrew the body from the cartridge holder and check if the cartridge has been inserted correctly. The following steps should be performed every time you use Follistim AQ cartridge with the Follistim Pen. To reduce the risk of infection, you must use a new BD microfine pen needle for each injection. The cartridge holder must have a cartridge in it before you attach a needle. You can see the cartridge through the window of the yellow cartridge holder. Clean the open end of the cartridge holder and rubber inlay of the Follistim AQ cartridge with an alcohol pad. Take the BD microfine pen needle unit and remove the protective paper seal. To keep the open needle clean, do not touch the exposed needle or place an open needle unit on any surface, but go directly to the next step. Hold the outer needle shield firmly and push the end of the yellow cartridge holder into the outer needle shield. Screw on tightly together. Place your Follistim pen with the loaded cartridge and the attached needle flat on a clean, dry surface. Follistim AQ cartridge is designed for injection under the skin, also referred to as subcutaneously. The recommended sites for injection include your upper thigh or just below your belly button where there is a lot of loose skin. When giving a subcutaneous injection, follow your healthcare provider's instruction about changing the site for each injection. This will help lower your chances of having a skin reaction. Do not touch the cleansed area of your skin. Do not inject Follistim AQ cartridge into an area that is tender, red, bruised, or hard. Use an alcohol pad or cotton ball moistened with alcohol to clean the area where the needle will be inserted. Clean about 2 inches around the point where the needle will be inserted and let the alcohol dry for at least 1 minute before proceeding. Carefully remove the outer needle shield by pulling out the shield gently, leaving the inner shield in place over the needle attached to the pen. Do not throw away the outer needle shield. You will use it to safely dispose of the needle after the injection. Carefully remove the inner needle shield and throw it away in a puncture-proof container. Do not touch the needle or let it touch any surface while uncapped. Hold the Follistim pen with the needle pointing upwards. Tap the cartridge holder gently with your finger to help the air bubbles rise to the top of the needle. The presence of small air bubbles will not affect the amount of medicine you receive. If you have loaded a new, unused cartridge into the Follistim pen, always follow these steps. A. Dial the dosage knob 1 mark on the dosage scale until you hear a click. With the needle pointing upwards, push the injection button in all the way. B. Look closely at the tip of the needle to see if a drop of fluid comes out. If you see a droplet, you can dial the dose. C. If no fluid droplet comes out, repeat these steps until a droplet flows out of the tip of the needle. If it does, this step is complete. If you have already used the Follistim AQ cartridge and you need to give yourself another dose, simply attach a new BD microfine pen needle and look for a droplet forming at the tip of the needle. If you see a droplet, go to the next step. If no droplet is seen, follow the previous steps. You must make sure you see a droplet of medicine or you may not inject the correct amount of medicine. For doses from 50 to 450 IU, turn the dosage knob until the correct dosage aligns with the dosage markers on each side of the dosage window. If your prescribed dose exceeds the deliverable dose of Follistim Pen or exceeds the amount remaining in the cartridge, you will need to give yourself more than 1 injection. If, by mistake, you dial past the correct number, do not try to turn the dosage knob backward to fix the mistake. If you turn the dosage knob backward to correct the mistake, it will not damage the Follistim pen, but you will lose some of the medication from the Follistim AQ cartridge. Never dial your dose or try to correct a dialing mistake when the needle is still in your skin, as this may result in receiving an incorrect dose. To reset the dose, continue to turn the dosage knob in the same direction past the 450 mark as far as it will turn. The dosage scale must move freely. Push the injection button in all the way and redial starting from 0 upwards. With this procedure, there is no loss of medicine. After setting the device to the appropriate dose, you are ready to inject. Pinch a fold of skin at the cleansed injection site. Do not touch the cleaned area of skin. With your other hand, hold the entire pen with cartridge and needle, like you would a pen. Use a quick, dart-like motion to insert the entire needle straight into the skin at an angle of approximately 90 degrees into the skin surface. Fully press the end of the injection button to make sure you give yourself a full injection. Wait 5 seconds before removing the needle from the skin. The middle of the dosage window should display a dot next to the 0. Pull out the needle. Firmly press an alcohol pad over the injection site for 5 seconds. Use the BD microfine pen needle for 1 injection only. Congratulations! You have now successfully administered your Follistim AQ cartridge dose. Place the outer needle shield on the table with the opening pointing up. Carefully insert the needle attached to the Follistim pen into the opening of the outer needle shield and push down firmly. Grip the outer needle shield and use it to unscrew the needle. Immediately place the needle with the outer needle shield in a puncture-proof container to avoid accidental injury. Your healthcare professional can advise you on how to obtain a special container for proper needle disposal. The Follistim pen is intended for self-injection for Follistim AQ cartridge. If you are giving an injection to another person, be very careful when removing the needle from the skin. Accidental needle sticks can transmit potentially serious or grave infectious diseases. Always take the needle off the Follistim pen. Never store the pen with the needle attached to avoid drug leaking and to reduce the risk of contamination. Put the pen cap back onto the pen body. If there is Follistim AQ cartridge medicine left for more injections, store the pen with the cartridge in a safe place out of reach of children. A used cartridge that has been pierced by a needle may be stored for a maximum of 28 days at 2 degrees to 25 degrees Celsius, 36 to 77 degrees Fahrenheit. A new cartridge can be stored at 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit, without freezing until the expiration date, or can be kept below 25 degrees Celsius, 77 degrees Fahrenheit, approximately room temperature, for a maximum of 3 months. Your Follistim pen is already loaded, and all you need to do is swab the opened end of the pen with an alcohol pad and attach a new needle. At this point, you should see a droplet formation at the tip of the needle. Once you see the droplet, dial the correct number on the dosage scale. The number represents the international units of Follistim AQ cartridge needed to complete your injection. Inject the prescribed dose. 1, 2, 3, 4, 5. By keeping records of your injections, you can see whether there's enough medication left in the cartridge for your next injection. If you realize before starting the injection that you do not have enough medication in your Follistim AQ cartridge for your dose, you have 2 choices. You can either throw away the used cartridge with the remaining drug and change to a new Follistim AQ cartridge to take, or dial the prescribed dose and finish the contents of the Follistim AQ cartridge in the Follistim pen. Then reload the pen with a new cartridge and new needle. Prepare the injection site and inject the remainder of your dose from that new Follistim AQ cartridge. However, if you realize too late, in other words, after starting the injection, that you do not have enough Follistim AQ in the cartridge, you have no choice. You must take the remainder of the dose from a new Follistim AQ cartridge. If you do not get your full dose from the first cartridge, the injection button will not push in all the way, and the number in the dosage window will not read 0, but will read the number of units you will need to complete your prescribed dose. Wait for 5 seconds before withdrawing the needle from your skin. 1, 2, 3, 4, 5. Firmly apply pressure to the injection site with an alcohol pad. Remove the used needle and dispose of it in the puncture-proof container. Write down the number in the dosage window at the point where the Follistim pen stopped. This will be the number you dial to complete your dose. Start over with a new cartridge and new needle. Make sure you choose a different injection site to complete your dose. Remove the empty cartridge. Using the dosage knob, reset the dosage window to 0 by turning the dosage knob past the 450 IU mark as far as it will go and push the injection button in all the way. Then load a new Follistim AQ cartridge. Prepare the Follistim Pen for injection as shown previously. Dial the position on the dosage scale that you wrote down. Inject the remainder of the prescribed dose. 1, 2, 3, 4, 5. Before removing the empty cartridge from the Follistim Pen, the needle must always be removed. Unscrew the pen body from the cartridge holder. Put down the pen body and remove the empty Follistim AQ cartridge from the cartridge holder. Dispose of the empty cartridge right away in the same puncture-proof container you used for your needle disposal. You can now either prepare the pen for loading the next cartridge or assemble the Follistim Pen without a cartridge and store for your next injection. Check with your healthcare provider or pharmacist for instructions about the right way to throw away used cartridges and needles. There may be special local or state laws about how to throw away used syringes and needles. Do not throw away used cartridges and needles in the household trash, and do not recycle them. Put used and empty cartridges and needles in a closable, puncture-resistant container. You may use a sharps container, such as a red biohazard container, a hard plastic container with a screw-on cap, such as an empty detergent bottle, or in a metal container with a plastic lid, such as a coffee can. When the container is full, tape around the cap or lid to make sure the cap or lid does not come off. When your injection is given by another person, this person must also be careful when removing the cartridge and needle and disposing of the cartridge and needle to prevent accidental needle stick injury and passing infection. We know that fertility treatment can often be very demanding. Hopefully, your treatment with Follistim AQ cartridge using the Follistim Pen injection will lead to a successful pregnancy. If you have any questions about Follistim Pen or Follistim AQ cartridge, ask your healthcare provider or call Merck & Company at 1-866-836-5633 or visit their website at www.follistim.com. For support services, you can visit www.fertilityjourney.com.